Oops. Good morning, everyone. I apologize for the delay. We had some technical difficulties, but I believe we are up and running and live on YouTube. So thank you all for joining us this morning for this panel. So this is the Wildfire Smoke, Air Quality, and Your Health panel, a panel discussion hosted by the Department of Environmental Health. Wildfires continue to affect people on both coasts of the United States this week, as fires in New York and New Jersey prompted a new wave of evacuations, and firefighters brought the mountain wildfire near Camarillo, California, under control after a week of intense battles with the blaze. Smoky, hazy air has impacted people in New York and Boston in recent weeks, leading to health concerns for parents of young children, people with asthma, and other sensitive groups. I also know we woke up this morning to yet another red flag warning day here in New England. So to talk about these concerns and how to mitigate them, we've gathered some local experts to answer some frequently asked questions about wildfire smoke and your health. So welcome, you all. Welcome to our panelists. I'm pleased to introduce Dr. Kari Nadeau from the Harvard T.H. Chan School of Public Health, where she is the John Rock Professor of Climate and Population Studies and the Chair of the Department of Environmental Health. We also have with us Dr. Joseph Allen, the Director of the Healthy Buildings Program and Associate Professor of Environmental Health at the Harvard T.H. Chan School of Public Health. And then joining us from the Boston University School of Public Health, we are thrilled to welcome Dr. Patrick Kinney, also from the Department of Environmental Health at Boston University, and Dr. Jennifer Stoll, a Climate and Health Research Scientist from Boston University School of Public Health. So welcome to you all, and thank you for joining us today. We'll start. I have a question for you, Dr. Stoll. What can you tell us about are the primary health risks or concerns associated with wildfire smoke exposure?
So wildfire smoke exposure is associated with a range of outcomes, generally respiratory issues, including things like coughing and wheezing, difficulty breathing, increased risk of things like respiratory infections. The biggest concern, however, is for individuals with pre-existing conditions like asthma and COPD, because exposure to smoke from wildfires can exacerbate these symptoms and then potentially increase the need to seek medical attention. So there's also some research that suggests an impact on cardiovascular health, but we are less certain of these impacts. So the things to be really concerned about are those respiratory related issues.
Great, thank you. And Dr. Nadeau, I know you've been seeing patients in your clinic who have been presenting with some of these concerns. Can you tell us a little bit more about what are the acute and chronic health effects of that wildfire smoke that you've seen in your clinic?
Oh, thank you. And thank you for having this panel. It's really wonderful to join my colleagues and faculty. I am, as a physician, really troubled by how much patients are suffering from wildfire smoke exposure, even after a day where the air quality index might be just barely over 100, which is not safe. And like Dr. Stowell said, if you already have a pre-existing condition in terms of health, that can worsen disease. And then there are also other diseases that can start due to wildfire smoke exposure, mostly over time and frequent exposures. So for example, asthma can worsen by about fourfold. I see that with my patients. My older patients have increases in stroke risk as well as heart attacks. And that's just on the acute side, with only being exposed to 1 to 4 days of wildfire smoke, like what we're being exposed to in parts of the Northeastern Corridor now. And then to answer your question about the chronic effects, there are data now, unfortunately, showing that when people are exposed to chronic wildfires, for example, maybe you're hundreds of miles away from a place at the wildland-urban interface. There are places in the West and Canada that get exposed to at least 3 wildfires a year. Studies have shown that those communities are at higher risk for cancer, lung cancer, brain cancer, thyroid cancer. And then finally, whether or not it's acute or chronic, mental stress is quite disabling. And the mental anxiety around having to be displaced and evacuate, losing your home, losing your animals, losing potentially loved ones, can affect someone acutely, but also chronically. And so these are all things that we really want to make sure that we're sensitive to and proactive to help in providing solutions for wildfire smoke. And that's what we're here today to do.
Thank you. So this is a follow-up question for both of you, which you've addressed a little bit, but who is really the most vulnerable to this wildfire smoke exposure? Who should be the most concerned at this point?
I can go first and then Kari can add. So that's a really great question. So in addition to some of these underlying health conditions that we've been speaking about, children and older adults, like Kari alluded to, tend to be particularly susceptible to some of the adverse effects of smoke inhalation. Pregnant women and their fetuses may also be at significant risk, but more research is needed in this area to better understand these negative impacts. And then in addition to these populations, also marginalized individuals tend to experience higher risk of health impacts. And these include individuals of color, folks with low income, and then the unhoused populations.
Dr. Stoll said it best, so I'll let the panel continue. Thank you.
Okay, thank you. Well, I'll switch over to you, Dr. Kinney. So can you tell us a little bit about what is in wildfire smoke and how it might be different than air pollution? Just dive.
Yeah, thanks. Thank
Kari.
you. Thank you, Carly, and thanks to Kari for organizing this symposium. I'm really excited to be part of it. One quick note on the previous question about who's vulnerable. I think we should also remember occupational folks, especially those who are fighting the fires, but people that are working outdoors and can't really protect themselves easily. There are masks and things that they can wear, but it's not always so effective, or they may not necessarily, under certain circumstances want to wear the mask. So let's worry about them as well. But going back to the question about what's in the pollution, wildfire smoke contains a lot of the pollutants that we're familiar with as environmental scientists, including particles, fine particles called PM 2.5. Also, there's a lot of organic material that is similar but often different from the kind of organic particles and vapors that we experience in cities. We kind of know what's in there. The mix is more complex than what we're used to in terms of urban air pollution, but I think it's the particles that we tend to focus on because we know the most about those health effects. So I'll stop there.
Okay, thank you. Dr. Stoll, do you have anything to add about that?
Yeah, so just kind of continuing with what Dr. Kinney said, there's actually research that does indicate that smoke might be more toxic than our everyday air pollution that we see. Some of the reason for this includes much higher concentrations of some of those pollutants like the particulate matter, as well as additional pollutants depending on the type of fuel that's being burned. This is actually of particular concern with fires that burn man-made structures, which we're seeing more and more because fires are getting humans are getting closer and closer to where the fires are. And this can introduce chemicals and particulates that are rarely found in our normal outdoor air. And some of those have been shown to have significant impacts on our human health. So this continues to be a concern as people move further and further into what we call the wildland urban interface. I think Kari mentioned that before. And what that means is that people are moving closer and closer to sources of dry fuel that can potentially be burned.
Yeah, thank you. And I'll just comment, when I talk to my patients, I basically say there's no safe distance from wildfire smoke. And unfortunately, is not so wild anymore. And 50% of fires, for example, in the West are burning up commercial buildings, your house. And so that contains detergents, paint thinners, and lots of other toxicants that are released up in the air and then can potentially get into your lungs and your bloodstream. So that's why we really want to be effective in adapting to wildfire smoke and reducing risks, as well as doing better in terms of managing our forests to prevent the amount of fuel that goes up in the air.
Thank you. Does the EPA regulate wildfire smoke in a different way than other types of air pollution?
Not really. Currently, wildfire smoke, to the extent that it affects air quality, is treated like any other kind of air pollution. But I think what EPA and other like state air pollution agencies are starting to realize is that more and more wildfire smoke is beginning to dominate the the extreme values of air quality. We've been pretty successful in the US over the last 40 years in controlling many of the human sources of air pollution. PM 2.5, that fine particle thing that I mentioned a minute ago, has come down quite a lot. But wildfire smoke is really challenging that sort of success story. And I think EPA and regulators in general are going to need to really think hard about how to treat wildfire smoke as a pollutant and what it means in terms of sort of the air quality regulations that we have in the US.
Yeah,
I
and
totally agree.
Oh,
Oh, go
sorry.
ahead, Dr. Stoll.
I was just going to say, if I can add to that, Pat is
Mhm.
correct in saying that we're actually starting to see a reversal of some of the strides that we've made in reducing, especially particulate matter. So there's a recent publication that came out in the last year or so that showed around 2014 or 2015, we're starting to see this negation of that negative trend. And a lot of that has been attributed to sources of wildfire smoke. And kind of going back to some of what Kari was talking about, the reason why we are concerned about that is because smoke travels long distances. They can travel across state boundaries, across country boundaries. And a great example of that is what we experienced last year here in the Northeast with the Canadian wildfires. We saw large amounts of smoke pollution that aren't normally seen in our air from the Canadian wildfires. And unfortunately, that's going to continue, and we're going to continue to see larger populations impacted by wildfire smoke exposure, even if they're hundreds of miles away from the fire itself.
Yeah, and the EPA has done a great job trying to monitor and regulate as much as it can, but air pollution in its composite includes wildfire smoke, like Dr. Kinney said, but it's very hard to regulate when wildfires, like Dr. Stoll said, can circumnavigate the world from Australia or Canada or other places. So this is something that we are dealing with in our society, and EPA and the Wildfire Commission that the Biden-Harris administration put together is working on this, but we need to make sure that we can try to make change at the local level and the state level to be able to mitigate and adapt to wildfire smoke.
Thank you all. I want to shift gears a little bit and now talk about how people can try to protect themselves and their families from this kind of ever-going situation of air quality and wildfire smoke. So, Kari, can you tell us a little bit, what do you tell your patients to do to reduce their risk of the health effects of this wildfire smoke?
Thank you. I'll talk very quickly because in summary, I'd really like Dr. Allen to talk about healthy buildings because Dr. Allen's in charge of our healthy buildings program. And so most importantly, many people go and retreat inside. And so we need to make sure that we focus on how to best advise them what to do when they go inside their homes. So I'm going to pass the baton to Dr. Allen in a second. But right now, the tools and resources that you see on your screen, everyone should be able to monitor and hopefully measure and manage their diseases, as well as importantly, looking at air quality. And that's important because you want to be able to understand how this personally affects you or your friends or your family. So when you go on the Air Now website, you can see, for example, areas of New York City that had high air quality indices. Anything in the yellow, orange, or red level are thresholds for which we think people can be at high risk for health effects. So it's important for you to know how to look on the web, how to get resources, how to go to your library and be able to access the internet if you don't have access in your own home, to be able to get this tool to help you know where the wildfires are spreading for the smoke and exposures. The other resources you can use are on the EPA website, the CDC website. There are wonderful personalized information packets to be able to help you prepare for wildfire smoke exposure, but they don't contain everything. And that's why I'd like to make sure I pass the baton now to Dr. Allen, because he's really going to help you know what to do, how to do it, and what masks, what filters to be able to best be used to help reduce your risk of wildfire smoke inhalation.
All right, well, thanks. It's a real pleasure to be here with my colleagues at Boston University School of Public Health and the Harvard School of Public Health. Yeah, I think there's a couple things people need to do or can do to protect themselves in the home. I think first and foremost is to recognize that wildfire smoke is not only an outdoor air pollution problem, it's an indoor air pollution problem, and this is why. Outdoor air pollution penetrates inside of our homes, our schools, our offices, and our hospitals. In typical home, maybe 50% of that outdoor pollution comes inside. And because you spend or take 90% of your breaths indoors, the majority of wildfire smoke you breathe happens inside. That sounds totally counterintuitive, but it's correct. Outside of workers who have to be outside, you move inside, you're going to be breathing a lot of that wildfire smoke unless you leverage your building, your home, your school, your office, hospital, everywhere else, to help defend against that infiltration of wildfire smoke. And there's a couple things you can do that are actually pretty straightforward. The first is we can improve the amount of filtration. Right? So these particles, primarily what we're interested in, are captured pretty easily on the types of filters maybe you've become familiar with because of the COVID pandemic. So you've probably seen HEPA filters or air cleaner and air purifier you can buy at the local store. These are very effective at capturing these particles that penetrate inside your building. You can also upgrade the type of filter that goes in your central mechanical system. You can talk to your building owner, building manager. If you have a house with central air conditioning, you can upgrade from what's called a MERV 8 filter to a MERV 13 filter. And let me put some numbers on this and why that's really important. Dr. Nadeau mentioned that, an unsafe level of air pollution is 100 micrograms per cubic meter, 100. Well, it turns out that a MERV 8 filter, the type of filter you find in a typical building, very cheap filter, might get that down to about 50. So it can knock it down by about half. But a MERV 13 filter will knock that 100 down to 8. And a HEPA filter will do even better. So the first thing is recognize outdoor air pollution is an indoor air pollution problem. Recognize that filtration can be very effective. And the third thing I'll say is add to what Dr. Nadeau said about the importance of measurement. So we posted some resources to look at outdoor air levels, but you can also use monitors like what I'm using in my office right now that actually measure PM 2.5. So if you see on the screen right now, the levels in my office are 6. So I know not only from these EPA resources what the outdoor levels are, I know my building is being effective right now. And I actually did a little experiment, and I can talk about it in a minute to see how effective these HEPA filters are. But those are really the big 3 things. Outdoor air pollution comes inside, we can enhance the level of filtration in our buildings, and we can also measure air quality inside to know if we're protected or not.
Great. Thank you, Dr. Allen. I want to toss it over to Dr. Kinney, see if there's anything else you would say about protecting ourselves, maybe when you're outside the home as well.
That was great, Joe. And I actually have a question for Joe. I was going to suggest, that masking could still be effective, even though we know that masks are not 100% effective. But just like the discussion we heard from Joe about the various kind of MERV filters, even a 50% reduction in concentrations and the amount of particles that you breathe into your lungs is helping. So I think on smoky days when the index goes above 100, I would wear a mask outdoors. I wonder if Joe would agree with that, because you know a lot more about this than I do.
Yeah, I mean, the same principles applies, right? That we're talking about basic filtration. A mask is just a filter. A blue mask, surgical mask, might get you 70% efficiency. Hopefully you've heard about an N95 mask, 95%. There's actually N100 masks. But it's not just the filtration, it's also the fit. So you got to think of the 2 Fs if you think about filters, the filtration and the fit. So it's got to fit flush to your face. And if you do this, I agree with you entirely that you can actually significantly reduce the amount of particles you're breathing in with a mask. So if you're outside, I think that's a good defense. Inside, I think there are things we can do so you don't have to wear a mask inside, and that is the things we can do with our buildings with some of these simple filtration and low cost filtration strategies.
Absolutely. So, first, when you know about wildfires, and if there's one close to your home, you want to evacuate. You want to listen to any of the alert systems that are on the AirNow website. So there are ways to get access to that if you live in a fire-prone area. Secondly, if you're exposed to wildfire smoke, as you see the AirNow website, look at filters for your homes. They should already be there, hopefully. If you don't have a filter, there's also websites to help you design one. And then also wear a mask, like Dr. Kinney and Dr. Allen were saying. But within that, know that it's hard to wear a mask, just like we learned in COVID for children, for people with beards. There are occupations, like Dr. Kinney referred to, that have to be outside and have to pick grapes or have to do labor while the exposure is happening. And that is really tough on those workers. Wearing an N95 mask is okay. That's the best we have. But I just want to make sure everyone knows who's listening that N95 masks don't reduce some of the gases that can still come in. So you should still be super careful and restrict that exposure to the outside however you can. Go indoors, make sure there's a filtered place where if you can measure it, like Dr. Allen was showing, you have low PM 2.5. Don't assume because you go indoors and you have a filter that it's working. So make sure that you can test that indoors and protect yourself. Thank you.
Yeah, can I add to that too? Because I think there's some good points about the types of filters. And I just want to show for a second. So I showed you a second. I have a HEPA filter running in here that's going to capture particles. And right before we went live, I artificially brought the smoke levels up in my office. So not great for me, but good for this little experiment. I lit a candle. So I don't normally have candles in my office, but I lit a candle. And look what it did. It put my levels at almost 200, right? Just in a few minutes. Right before we came on the air, I turned on my HEPA filter, and now I was at 6 before, now I'm at 0, essentially non-detectable levels of these particles, right? My CO2 is not great because I've shut off the ventilation for this experiment. My particle levels are low. These filters work really well. Dr. Nadeau mentioned these other types of pollutants we're interested in, not just the particles, but also the gas phase pollutants. If you want to protect yourself against those, there are different types of filters you can get. Some of these portable air cleaners not only have filters that capture particles, they also have filters that will capture the gaseous pollutants, the gas phase pollutants that would normally slip through a filter. So you'd have these two. Look for something with activated carbon or activated charcoal. So you can get a portable air cleaner with a HEPA filter. And if you really want to also control these gas phase pollutants, look for one that also has activated carbon or activated charcoal. Very important, one last thing on filters. They only work if they're sized correctly for the space you're in. That should be obvious. You put a small little filter in a giant gymnasium, not going to do much. We have a really simple tool on the Harvard Healthy Buildings website. We'll link it out as a resource where you can actually calculate the right size portable air cleaner for your kid's bedroom, your classroom, your office. So you just got to size it correctly and look for these devices that have both of these kind of filters that can protect against both particles and gases.
Thank you, Dr. Allen. I'm going to go ahead and put the Healthy Buildings website up on the screen so folks know where to access this information, because I think this is really important. And I'll also put the link in the comments on the video as well. But I just want to help folks that are watching navigate to where they can find all this important information. So thank you very much. I want to pivot a little bit to talk about the fact that it seems like these wildfires are becoming much more common. Growing up in California, they were a common experience, in the West, in the Southwest, but even more common now. And also in places that haven't typically been affected by wildflowers. We've had weeks of red flag conditions here in New England, which feels really unusual this time of year. So I was hoping, Dr. Stoll, you could talk a little bit about how does climate change influence the frequency and intensity of these wildfires? Should we be concerned about the combinations of exposures like wildfire smoke and some of the extreme heat conditions we've seen this year?
Yeah, another great question. So as you might expect, a warming atmosphere due to climate change will continue to fuel these larger, more frequent, and even more intense wildfires, not just here in the US, but across the globe. We've seen an increase in particulate matter air pollution, again, as I mentioned before, starting somewhere around 2014, 2015. And this, again, has been attributed in part to increased wildfire activity. And as the temperatures continue to rise, we're going to have longer wildfire seasons as well. So giving more days with opportunities for us to be able to be exposed. And we call those fire weather days, or days with conditions that are favorable to fires. And unfortunately, some of the things that go into those fire favorable days are things like extreme heat and drought. And those, separate from wildfires, have their own impact on human health. But the combination of the two can be what we call synergistic. meaning that the overall health impacts that we see are actually greater than what you might expect if you were just calculating the impacts due to the smoke and the impacts due to something like extreme heat. If you just added the sum of those together, it's actually less than what we see when we calculate the impacts based on both. So we look at kind of this synergistic impact, and that's one of the directions that the field is moving in, is trying to understand these either cascading or concurrent exposures that are occurring, because they are going to put greater stress on our health systems and our bodily functions, and likely have even, magnified impacts.
Right, thank you. And I want to go back, Dr. Allen. I saw last summer during the extreme heat and wildfire conditions of last summer that the Healthy Buildings Program released an important advisory about filters. So I just wanted to go back to you to see if you had any more context or information to add about that.
Yeah, this is actually really important and something not enough people are talking about. But let me start first let's be clear, filters work. It's important to upgrade your filters. HEPA filters work, and there are some filters out there, including some of these MERV 13 filters, that rely on a technology that can the performance can degrade over time. So to put this really simply, some of the MERV 13 filters you might buy for your house use an electrostatic charge. Basically, they're charged fibers to help capture these smoke particles. Well, these kind of filters can lose their efficacy over time. The charge becomes less effective. And it turns out it can be quite significant. So you can pull up the advisory we released. There's a few studies, particularly some new studies, are showing that some of these filters drop up to 95% in performance. So what can you do as a consumer? One, you could try to buy a filter that doesn't rely on these electrostatic properties. It's hard sometimes a consumer to know. I think the simpler thing for a consumer to do is change out your filters more frequently. Typically, some people do it every year, or do it at least twice a year, maybe 4 times a year. They're not all that expensive. And definitely, if you just had a wildfire smoke event near you, it's smart to change out those filters. But I think bigger level, I think we need manufacturers to kind of disclose the performance rating, not at the time you purchase this, but actually what happens over time under real world conditions. So again, big picture, filters work. It's really important to increase your level of filtration. If you're looking at a portable air cleaner, get one with a HEPA filter. These do not rely on that electrostatic problem. Their performance does not significantly degrade over time. If you're using a MERV 13 filter, try to determine if it's electrostatic or not. If it is, change out your filter a bit more frequently. I think you'll see a lot more of this being talked about, but for right now, I just want to tip people off that there's a difference in the quality of these filters, and manufacturers, the call on manufacturers really to disclose performance degradation over time. So a consumer knows, if I buy this filter on day one, what's the slippage in 10 weeks, 20 weeks, 30 weeks, 40 weeks.
Thank you for that clarification. I'm going to end by kind of staying on the topic of policies and regulations. And I have a question for you, Dr. Nadeau. I know there have been some new policies developed by the U.S. Wildfire Commission in 2023. And so can you talk a little bit about how they are potentially helping us reduce some of this wildfire smoke risk?
I also would like to make sure that after I comment, I want to make sure Dr. Kinney, Dr. Stoll, and Dr. Allen get to comment as well, because they've been involved in a lot of this policy as well as the science behind it, because we wouldn't be anywhere without the science that helps inform the policy. And that's really important as we think about how to direct the best policies for public health and individual health. Today, we've been talking a lot and giving you all, hopefully in the audience, recommendations for how you can protect yourself, your families, but also we're hoping this helps public health officials, because within our public health mission and our values that drive towards prevention, we need to think about solutions up front. And those solutions include adaptation to certain issues around wildfire smoke exposure, as well as prevention. And prevention comes in a lot of different shapes and sizes. So that's what I'll talk about now. The U.S. Wildfire Commission brought together bipartisan representatives from across the U.S., which was quite commendable. This was formulated by Congress. Congress put resources in over the past 4 years to be able to support the Wildfires Commission's policies. And those policies were created and consensus driven based on 50 people that represented forest management, represented wildland firefighters, represented the Department of the Interior, USDA, as well as FEMA. And it was an incredible group of people that came together, and I was very lucky to be part of that 50. And so to answer your question, Carly, the policy that we made, people can find on the web. The first policy was to get better resources for managing fires and monitoring fires. So the minute that a small fire is found by a plane or a drone, immediately go in there and try to douse the fire with sand and water and alert the community immediately so that there's less risk and less deaths. Then, in addition, to alert the wildland firefighters resources, and this is mostly being talked about in the West, but now that we're seeing this happen in the Northeast, the same policies can create the same policies to implement across the Northeast. So with that important process being changed, I'm hoping that the states across the Northeast will also be changed with the policies that worked effectively for the West. Not that they're perfect yet, but we're getting there. We've learned a lot from the western part of our country, and that will help, hopefully, the eastern part of our country now develop better processes for managing forests, including traditional ecology. And so what we learned in the Wildfire Commission is that policy that was actually not typically what we would say is policy, but that our Native American populations practiced for thousands of years by clearing out the underbrush of a given forest. And by being able to clear out the dead trees, then you create less fuel to be able to have an intense fire. Some of the wildfires in the West now are spreading at a football field a second. And so people cannot get out of the way. And that's dangerous for people, for animals, for our planet. But one of the things we can do is reduce that fuel that intensifies the fire going through communities. And because of global climate change, about 50% of our wildfires are associated with climate change. So we need to also get ahead of reducing greenhouse gas emissions, reducing fossil fuel dependencies. So that's another part of what we talked about for policies. And then finally, we also talked about policies that engage better monitoring. And then lastly, we talked about policies to help public health officials educate their public on how to adapt to wildfire smoke exposure, which includes, for example, this panel that we're talking about today. We also need to protect those most vulnerable, as we spoke about. So the policies that we put into place, we need to make sure that no one is left behind. And so we're going to actually monitor how well these policies worked. And the first people we're going to monitor are the wildland firefighters to make sure that they're protected, and then also people without homes. And we're going to be asking public health officials to see to what extent the commission's advice helped. So for any policy, for example, and this is a good example of one, we need to ensure and metric and make sure that it's working or not working. And if it's not working, who it's not working in, and make sure that we can change policies to adapt to a changing climate and a changing world with wildfires.
Thank you.
What do others think? I want to make sure I pass the baton to all of you to talk about policy.
I'll jump in really quickly. I think you covered a lot of base. I'm really excited to hear about the good work of the commission. I think that, you know, as I said before, we've been pretty successful with air quality in the last few decades. We know how to put controls on smokestacks and car exhausts and things like that. Wildfire smoke is a really new challenge, and I think these ideas, these solutions that have been put forward by the Wildfire Commission, I think will get us started towards understanding how to really address this challenging problem. Also, just to emphasize the importance of leadership on addressing climate change. Really, wildfires are, you know, affecting our health and are being made worse by climate change. There's many other ways that climate change is affecting the health of ourselves and our families. And the more that the US can take a leadership role in addressing this problem, the quicker we'll be able to solve the wildfire as well as many other climate-related health impacts. Passing off to Joe, do you have something?
Sure, I'm happy to go next. A couple things related again to the building space. I actually think there's some healthy building strategies we should be pursuing from a policy perspective. First is we should be mandating these higher grade filters. Right now, we put in filters that protect equipment, not people. These are not very expensive. And when we upgrade our filtration, we get multiple benefits. Helps protect us against wildfire smoke, other sources of outdoor air pollution, asthmagens, allergens, and also helps protect against respiratory pathogens like SARS-CoV-2, influenza, and RSV. Another thing we need to do is on the monitoring side related to our buildings, and that is to require indoor air quality monitoring. There's been a couple bills that have been started to be pushed. I'd like to see these pass. I know Boston Public Schools is monitoring indoor air quality in schools. That's really different, and they're sharing the data with parents, kids, and administrators. Denver Public Schools also doing this. We see lots of companies moving this direction. I think we need more of it. Third, we have some bipartisan legislation. There was a Indoor Air Quality and Healthy Schools Act that I helped work on with many others, put forward by Tonko and Fitzpatrick, that tries to codify the EPA's Indoor Environments Division, help set new health-based targets for indoor air quality, including things like smoke that penetrates inside. So I want to see that bipartisan legislation go through. In terms of our standard-setting bodies and what companies need to do. So I mentioned earlier that companies need to not just disclose performance of filters that you buy on day 1, but what happens on day 2, 3, 4, day 100 in real world conditions. That should be disclosed so consumers know what they're buying. Related to that, there's a standard setting body called ASHRAE that sets standards for filter performance testing. Currently, it's only required to test filter performance on that day 1 performance. Part of that standard has a voluntary disclosure that is a real world test over time. That ASHRAE should make that voluntary disclosure a requirement to release results on not just day 1, but what happens over time. I think if we do all of that, we can make great improvements to the health of people inside all of our buildings, our schools, offices, homes, and everywhere else we spend time, and really start to think of our buildings as a public health tool to promote good health through good indoor air quality. Thanks for having me on.
Yeah, Dr. Stoll, any comments on policy?
Yeah, just going back to a couple of different points. I think Kari, you made, and maybe Pat a little bit, the point about people who are forced to work outside. So in addition to the wildfire smoke or wildfire fires, there's also a host of people who are, agriculture workers, construction workers, many types of workers who unfortunately tend to be paid by the hour or by the task that they're doing. And so the luxury of staying home because there's smoke in the air is much harder for them to do, because missing a few days of work might mean I can't pay my rent. And so I think policies, where there's talk of some of these heat policies looking at workers, but we also need to be thinking about wildfire smoke in conjunction with that. And then also, what do we do when we say, okay, you're not required to work today, stay home, but how does that help them? It might actually be a hurt in a different way. And then the other point that I wanted to make is when we think about our air quality index, right now we treat it as all pollution being equal. So we're just measuring a count of the number of particles or things like that that's in the air, but there's not really any policy that's looking at the actual mixture that's out there. And so going back to some of the comments about toxicity and what's in wildfire smoke, I would suggest that we might want to start thinking about perhaps adjusting our air quality index on days when we know that wildfire smoke is there. I'm not the right person to do all of that, but that's just a policy measure that I think could be really helpful in helping the public understand that the air is potentially worse for their health than it would be on a day with similar concentrations, but no smoke in the air.
Great points.
Thank you all. I do want to just leave it open, if you had one takeaway that people watching this could think about as far as mitigating their health concerns and really knowing what days to be the most worried about, what would that takeaway be for your patients, for the audience watching, if they think about their own health?
I'll let Dr. Kinney go first, then Dr. Allen, then Dr. Stoll, then myself.
I think what I take away mostly from this discussion is that there are ways that we can protect ourselves, at least as individuals and especially indoors. And we should take the advice that Dr. Allen has given us in terms of filtration, and we can reduce our risks substantially.
Yeah, mine is the first point I made is that we have to recognize outdoor air pollution is an indoor air pollution problem. I get very frustrated when I see public officials out there giving guidance related to wildfire smoke. For those who can go inside, they say go inside. That's not enough. You have to go inside to a place that has good levels of filtration. Otherwise, you're breathing lower amounts of that smoke, but because you spend so much time inside, you're actually dose, or the total amount you breathe is higher. It doesn't make sense to just say go inside. We have to also pair that with messages around good filtration. And also, this is not expensive. Filters are not an expensive intervention. So it can be done very cheaply. The technology is right there for us. We just have to rethink how we think about buildings, not as minimum standards for just barely acceptable indoor air quality, but actually think about healthy building standards, which are pretty easy to achieve.
Thanks for that. I think I'd like to just add a little bit, kind of bringing in the indoor air quality piece, but also with this, some of the unique things about the Northeast. Not everyone has air filtration or air conditioning, and wildfires tend to happen. Right now it's not hot, but wildfires happen a lot in conjunction with heat. And so when we tell people to stay indoors, but they don't have air conditioning, we're actually causing additional stress. And so helping people also to understand that going indoors, but having to open your windows because you're so hot, it's not helping you at all. And so I think that, starting to think creatively around those things, how do we make air conditioning or air filtration more available for people who may not be able to afford it? How do we make it such that they are able to pay their electric bills if they are needing to run air purifiers or air conditioners? So yeah, I think that's another consideration to be thinking about when we're thinking about these compound exposures, as well as needing to be indoors.
Thank you. And I just want to thank my amazing colleagues for joining us today, and thank Kari Sternburn for organizing and having this session. And we hope that it was helpful to you. Like anything, we learn by doing research. We learn by educating, and we're trying to create these panels to help you and the public really understand what to do. And we've talked about many concepts today: prevention, as well as how to best adapt to wildfires. And I hope that many of you on the individual level, as well as on the public level, can be that change towards solutions that involve climate change policy to mitigate and reduce greenhouse gas emissions, solutions that pertain to talking to your doctor, making sure that you're safe and protected, as well as solutions to protect the public and your families and generations to come. And so with that in mind, we're really hoping that you understand that across Boston University, Harvard University, Chan School of Public Health, as well as many places around the US and the world, we are doing research, but that research continues to give us more data, more science to help shape policy. And so we'll continue to update you. Please go on our websites. Please go on the websites we suggested to you, because this could change over time. What we're telling you today is what we can tell you today, but data changes, science changes, and we always want to improve to be able to help you and the public. Thank you.
Thank you all. I really appreciate you taking the time today to provide this important information. I also want to thank our comms intern here at the Department of Public Health, or Department of Environmental Health, Caroline, for helping with the technical side of things today. So we'll post the links in the comments for anyone watching and wondering where you can get more resources. And thank you all. I hope you all have a great day.